All right, good afternoon, everybody, and welcome to this webinar presented by Disability Rights New Jersey and the New Jersey Council on Developmental Disabilities. And today we'll be giving you an overview of Medicaid eligibility and really just the basics. My name is Michael Brower. I am a managing attorney at Disability Rights New Jersey. You're going to hear a few bits of housekeeping, and then I'll be introducing our main presenter, Gwen Orlowski, who's our executive director. The housekeeping stuff first, though. You'll note that as you came in, your microphones are muted. You can turn your video on if you please. Later on, we're going to have a question and answer session where I'll lift the lock on the microphones. That way, if you want to unmute yourself or ask any questions, you can do it then. In the meantime, if you have a question, a comment, a thought, or a concern, you can feel free to put that in the chat box, which is available in the black Zoom bar under the chat button. If you don't see it right away, you'll see 3 little dots that are labeled more. If you click that, you're going to drop down with some more options and you'll see the chat there. We're also using automatic captions for this seminar. If you'd like to see those, you'll see the CC button that allows you to see the live transcript as we go. That's automatically generated. Generally pretty good. If you have any concerns or questions, feel free to message me in the chat directly, and I can help you work those out. All right, I think that's basically all of our housekeeping. We're planning to run for the full hour, so let's get started. Again, I'm Michael Brower. I'm a managing attorney at Disability Rights New Jersey. I manage our community inclusion team, which is the legal team that helps folks who live in the community, whether that's their own home, a family home, a group home, or some other integrated setting, helps folks in those settings address various legal problems. So it's a pretty wide-based team. And I would also like to introduce Gwen Orlowski, who's our executive director at Disability Rights New Jersey. She's really our resident Medicaid expert and will be taking us through the presentation. For those of you who might not be familiar with Disability Rights New Jersey, we are New Jersey's designated protection advocacy agency. What that means is we really have 2 big functions. Our first big function is our core function is to make sure that individuals with disabilities are not subject to abuse or neglect. So we have investigative roles where we can investigate allegations of abuse and neglect. We have a monitoring role where we can look out affirmatively to try to see if we see signs of abuse and neglect in any kind of a facility where individuals with disabilities live, work, or otherwise receive services. The other big role that we have as a protection and advocacy agency is as a law firm. We're a nonprofit law firm that represents individuals with disabilities in several legal matters based on our board set priorities. And we can provide anything from advice, self-advocacy assistance to full-on representation in court. And of course, there's events just like this one that we're having today, where we engage in outreach or training to try to help individuals with disabilities, their family members, service providers, other stakeholders with information that advances our mission of preserving and advancing the human, civil, and legal rights of persons with disabilities. So now that you know who we are and about the agency, I'm going to pass the microphone off to Gwen to take it away. Go ahead, Gwen.
Great. Thank you so much, Michael. I'm first going to make sure that I can be heard. Just a thumbs up. Great. Excellent. So I'm really excited to be with everybody here today and to talk about Medicaid basics. I want to let you know at the get-go, one of the reasons this is so exciting is this is the first time I'm presenting a webinar back in our office in Trenton since COVID began. And Michael's here in the office too. We're in different offices, but at least we're physically in the same spot. And I hope that this is a sign that maybe we're starting to get back to some sense of normalcy, though we do all still wear our masks in the office. But the downside to that is that I'm not in my normal workstation and I'm here on a laptop and we've kind of tried to configure it. So I just ask with a little patience with everyone because I might have to scramble papers every now and then. And I don't have 2 screens, so I can't see your questions at the same time that I'm talking. So just bear with me on that. So I just want to touch first on today's learning takeaways. I will be speaking along with Michael about important Medicaid rules and rights. And I think we all know that Medicaid is important in its own right because Medicaid provides health insurance for nearly 2 million New Jersey residents. But it's also critically important for individuals who need long-term services and supports, especially those who are receiving their services through the Division of Developmental Disabilities, or DDD. So here are the goals for today's session. And the first one is one that, I just speak about all the time, is that there are many ways to be eligible for Medicaid. So people talk about Medicaid as if it is a singular entity, a singular program. It's not, and we'll be looking a little bit at that. And you only need to be eligible under one program. If you're eligible under one program, then you're eligible. Now, the benefits you receive, the services that you get may be different based upon which program eligibility you have, but you are a Medicaid beneficiary. My next takeaway is that one may not be terminated from any particular Medicaid program until the Medicaid agency reviews that individual for all program eligibility. And that's a big one, and one that we've been working with the state of New Jersey for several years now to make sure that they're in compliance with that. And sometimes mistakes are made, which is one of the reasons that we're here at Disability Rights New Jersey. And then the last in my section is that you have appeal rights and a right to continuation of benefits pending appeal. And then finally, Michael's going to talk a little bit at the end about where we are right now in Medicaid, because we still are in our public health emergency, and we have what we call the Medicaid moratorium in place. And he'll talk about that and what we should expect coming up in the future. Next slide, please, Michael. So I love this graphic. I had an intern from Rutgers School of Public Policy, Health Policy at Blaustein several years ago. So a shout out to Janisha, who just became a lawyer. And she created this for me. And I love it because I think it really helps us visualize that New Jersey Family Care, that under the umbrella of New Jersey Family Care, there are many ways we can get Medicaid eligibility. I call them Medicaid eligibility doors, and this is just a fraction of them, but some of the most common. I also really like this graphic because it has the bandage in the New Jersey Family Care title. And I like to remind people that New Jersey Family Care is a brand name that the state of New Jersey, just like Band-Aid is a brand name for a bandage, it's a brand name that the state of New Jersey gives to its Medicaid program and its CHIP program, which is Children's Health Insurance Program, which I will not be talking about today. And that's important because they sometimes also use New Jersey Family Care in a different way to mean the third door from the left, the New Jersey Family Care Affordable Care Out Expansion Medicaid. And that sometimes can be confusing to people. They're not really clear what kind of Medicaid they're on. So as we go through this, I'll sort of highlight some of that. So next slide, please, Michael. So I'm sort of starting at the end of the spectrum that has the lowest income and then moving up. And at the end, I'll touch on some of the programs that are available for DDD clients that are not in these general programs. So the first that I'm going to talk about is Medicaid that's either related to the fact that you get supplemental security income, or SSI, or what's known as Medicaid only. Medicaid only is administered by the state, and it means that you're eligible for SSI, but for whatever reason, you don't want the cash assistance. All you want is the Medicaid that goes with it. So Medicaid only. I'm not going to do a deep dive on all the eligibility criteria for Medicaid. You'll have the slides, so you can go back and reference these. So I'll just do some overarching highlights of these different programs. So for SSI related or Medicaid only Medicaid, the eligibility criteria are the same. You have to either be 65 and older, blind or disabled in any age. The income level ties to the SSI levels, and those levels are different depending whether or not you're an individual or a couple with disability, and it also depends on where you live. So living in your own home results in a different benefit amount, and so Medicaid limit than if, for example, you're in a residential healthcare facility. So this is just an example for an individual. This year, it's $825 25, and that changes from year to year. And I would be remiss if I didn't mention that you also have to take into consideration in-kind support and maintenance in these calculations. Resources are very low for these programs, $2,000 for an individual, $3,000 for a couple. I see a question pop up. The income is monthly, not weekly. Yes, this is very, very low income. Next slide, please, Michael. I think the important thing to know about SSI-related Medicaid is that that you receive Medicaid as an SSI recipient, and you don't have to do anything extra. You do your SSI application, that's processed by the Social Security Administration, the federal government, you're found eligible. There's communication between the Social Security Administration and New Jersey Medicaid to enroll you in the Medicaid program. You don't have to do a separate application for that. That can also create some transition issues on the other side if for some reason you lose SSI, and I'll talk about that a little bit later. If you're interested in being just in the Medicaid program, the Medicaid only that goes along with this very low income eligibility criteria, you can preferably do that online, and here's the link to that. And I can't speak right now to whether or not county welfare agencies are open, but before COVID, you could also do it in person. But the state really encourages people to use the online application. And I think it's a good thing to do because there's a paper trail and an email trail for when you applied. If you're found eligible, you get what's called Plan A. The state plan, Plan A, is the most generous, robust package that we have that does not include long-term services and supports. I'm going to talk about that later. The exception, and a lot of people don't know this, is that personal care assistance, or PCA, is part of our state plan in New Jersey. That's an optional service, but New Jersey has it. And so you can get personal care assistance if you are on Plan A through either SSI or through the Medicaid only program. Next slide, Michael. Next slide. Michael, I don't know if maybe something's going wrong for me, but I'm still seeing the where do I apply slide. I'm looking for the NJ Care, age blind and disabled. I think we have some technical difficulties. So Michael, I'm going to ask, can you take yourself off of mute? I apologize. I'm just not sure what's going on. Am I frozen? Somebody's saying I'm not frozen, but my slide hasn't changed. I apologize, everyone. I'm just writing Michael a quick little note. Oh, I think Michael was having probably some technical difficulties, I'm guessing. Give us a moment, and if we can't bring it back, the slides back online, I will talk from my notes and we will post the slides later.
Sorry about that, everybody. I think I'm getting back online. Had a quick computer freeze.
So it was Michael who was frozen. Got it.
That is me. I'm going to get this
Sorry.
going for just one more second. Apologies about that.
No problem. So somebody was asking a question about this income for disabled children. Those are really the SSI rules around children and parents and disability are much more complicated and are beyond the scope of this presentation. But I'm happy to see if after this presentation, I can get some information together and post it as well in the coming, by the end of September. All right. Any luck, Michael? No? Okay, you know what I'm going to do? I'm going to see if I do appreciate everyone's patience with us. This is part of being back in the office, I think. I'm going to see if I can pull it up, if I can share my slides. Can I do that, Michael?
Yes, you should be able to.
All right, let's see. Give a second. Okay, so let me see. I got the slides up. Everybody, thank you for your patience. And now I want to share my screen, right, Michael? Okay. And I'm going to share. And hopefully I'm going to go from the beginning. Okay. Thumbs up, Michael. Are people seeing the slides now?
I don't know because I can't see them.
Okay, so I can see somebody giving me thumbs up. Great. Thank you so much. Whoever's doing that. I can't see your face, but I can see your thumb. So I really appreciate it. Okay, so we are now on to New Jersey Care or Age Blind and Disabled. So some people like to refer to this program as the first Medicaid expansion. I believe it was 1988, but don't quote me on that. And at that point in time, Congress told states it was an optional expansion, that they could increase the level of income eligibility up to 100% of the federal poverty level. And you can see that number here for this year, 1,074 for an individual. And that's a lot higher than the SSI level. They also allow for higher resources, $4,000 for an individual and $6,000 for a couple. Now you may see that there are a lot of red stars on this page, and there's a reason for a lot of red stars next to income. And that's because how one counts income for this program for a household greater than one actually was argued before the New Jersey Supreme Court on Tuesday through cases brought by Legal Services of New Jersey and South Jersey Legal Services. And both the Community Health Law Project and we at Disability Rights New Jersey were amicus in that case. I think the argument went well, but I don't want to jinx anything. But I can't really tell you more. There's a lot more nuance here, but since we're in a period of flux, I'm not going to say anything more of that now, other than income counting is in flux on this program if you're a household of more than one until the New Jersey Supreme Court rules on it. Where do you apply? You also apply either with the county welfare agency or online. This is a different link. No, this is the same link, but in a second, we're going to have a different link. So I embed them there so you can use them, but they go to different applications depending on what you're applying for. And this also is Plan A if you're found eligible. Next, I'm going to talk about the more recent expansion of Medicaid that many of us remember from 2014 under the Affordable Care Act. This program goes by a lot of different names. I'm talking right now, by the way, about eligibility for single adults and parents. Adults, it shouldn't really say single there, you can be married. And I would say that this sometimes also goes by the name New Jersey Family Care. So I just alert you that it is the same name as the whole program. And it really has to do with who's processing applications. There's a vendor that is called New Jersey Family Care that processes a lot of these, but not all. So it's also known as ACA or expansion or MAGI, which stands for Modified Adjusted Gross Income, or Obamacare Medicaid. It goes by a lot of different names. This program, I'm going to touch on children briefly later, but for adults, it covers 21 through 64-year-olds. It's really important to know this, that once you turn 65, you're no longer eligible for this Medicaid program. So people really need to, if they're on this program, they need to do some advanced planning to think what's going to happen when I turn 65. You do not need a disability determination to be on this expansion or MAGI Medicaid. However, if you have a disability determination, and you can, you lose eligibility for this program once you're eligible to receive Medicare. And you notice here I've underlined eligible. So you can't say, well, I didn't take it. I refused my Part B Medicare. That's expensive. You still won't be eligible for this Medicaid program. So again, you need to do some advanced planning. You need to think about what Medicaid program you can transition to and how to best coordinate your Medicare and your potential Medicaid benefits. The modified adjusted gross income is 138% of the federal poverty level, which this year is $1,482 a month for an individual. So seem much higher than when we began with the SSI. And that ties to a different counting methodology for income based upon your income taxes. And the other big factor here in red is that there is no resource limit in this program. It's the only program that does not have a resource limit, and that's really good for a lot of reasons. However, when you're not eligible for it anymore and you have to transition to one of the other programs, you have to think ahead about the resource eligibility. Here you can apply online at NewJerseyFamilyCare.org, and there is an online application, which is different from the online application for the age blind and disabled. You can also download a paper application, and most are done through the vendor, which I already mentioned. Here you don't get Plan A, you get what's called the Alternative Benefit Plan, or ABP. I used to have to talk about it a lot. I don't anymore because it basically aligns with Plan A with very small exceptions to it, just a couple. All right, the next program I'm going to talk about is New Jersey Workability. I'm not going to say too much about Workability today because we are going to have an entire presentation on Workability that will be recorded and will be available on our website, also done in cooperation with the New Jersey Council for Developmental Disabilities. We're really appreciative of this partnership we've had with them. So the thing about Workability is it really allows individuals who are receiving SSDI on their own work record to be able to engage in work and earn a fairly significant amount of money and still remain Medicaid eligible. So you have to be between 16 and 64 years old, though there's legislation pending to change that. You have to work full or part-time with proof of employment. I just note that there's a Medicaid communication that says you have to earn at least $400 and file federal taxes, though we can't actually find the federal authority that requires that. So just kind of note that. And you need a disability determination. They look at earned income and unearned income differently on this program, or distinctly, in coming up with the threshold. And so there's not one number I can give you. It's really an individualized calculation. And as I said, we'll have a full webinar on this. But if an individual had no unearned income, they could have gross earned income in a month, this is in a month, of $5,433 for an individual. So you can see just there how significant a difference of income, earned income, compared to, for example, the SSI related Medicaid or Medicaid only. Unearned income has to be below the federal poverty limit, that same 1074 this year for an individual. However, your SSDI on your own record is not counted. So that is one of the ways that one who has SSDI finds eligibility for this program. Resources also are significant. Sorry, we just had a little recording blip there. The resources are $20,000 for an individual, $30,000 for a couple. Again, your home and your car. are exempt. And then the other significant resource that is exempt is one's retirement savings. So a 401k, 403b, IRA, things like that. So that is really significant for this program and allows an individual on Medicaid, at least until they turn 64, to really build up savings. I have a link at the top of this page. I put it there because there's good newer state information about the program. And again, when you have the slides, I believe you should be able to click, link directly through. Workability is, again, an online or in the county welfare agency. It's the ABD application, and there's the link is on one of the previous slides. And here I provide a link to the page for Human Services about workability, so you can get more information there. And this too would be Plan A. Before I go into the DDD specific Medicaid programs, or the programs that are specific for individuals with intellectual and developmental disabilities, I want to touch on managed long-term services and supports, or MLTSS. This used to be called institutional Medicaid. Now it's part of our 1115 waiver, which is the way we deliver most of our Medicaid programs now in the state of New Jersey. So this is the program, other than the workability, that has the highest income limits. It's $2,382 a month this year for an individual. Notice there's a star here too. That star is there because if you bump down to the bottom bullet here, you can have income above that amount if you establish something called a qualified income trust, or a QIT. And talking more about that is beyond the scope of this conversation today. I will say this, Michael's going to mention at the end, we're actually in the renewal for our 1115 waiver, and how the QIT is working is one of the issues that the state Medicaid agency is seeking stakeholder input. So Michael will tell you more about that at the end, how you can participate. The other thing about income for this program is that they only look at an individual. They do not look at a spouse. Under the federal, what are called the spousal impoverishment protections, they disregard, or they don't deem the income of the spouse who is not looking for services. And so you really only look at the person who's seeking to be an MLTSS Medicaid beneficiary. Resources here are low again, back down to that 2000. And they do a 5-year look back, and this is rigorous by the county welfare agencies, and there can be no gifting or transfer of assets for less than fair market value in that 5-year period, or you have a penalty period to receive the long-term services and supports, though you do get Medicaid ancillary services during that penalty period. This program, in addition to being age blind or disabled, also has a clinical eligibility requirement, and that is that you need hands-on assistance in 3 activities of daily living. I give an example of some of them here: bathing, dressing, ambulation, transfer, eating, bed mobility. I may not have gotten them all. If you have a cognitive impairment, you need supervision or cueing in 3 of those same ADLs, or a combination of both. So for example, maybe you need supervision with dressing, but you need hands-on assistance with bathing. For individuals 20 years old or younger, they can be on MLTSS. However, they have more stringent medically necessary criteria rather than just that hands-on assistance for 3 ADLs. It's more tied to, pardon me, a skilled nursing need. And this is an array of all the different services that are, and I apologize, I have a little cough there, available under MLTSS. I want to point out again that that PCA benefit is really a state plan benefit, so you don't need to be on MLTSS. But for people at higher incomes, that's how you can access the personal care assistance. Also, private duty nursing has has that medically necessary standard under this program. And this program also covers assisted living facilities and nursing homes. So to apply for MLTSS, one thing you can do is go through the Aging and Disability Resource Center or connection, and the telephone numbers here. And part of what they will do, they'll do a screening and then make a referral to the state office with nurses called the Office of Community Choice Options, or OCO, who does the clinical screen for that nursing facility level of care if you're new to Medicaid. If you're already enrolled in Medicaid, and I may have failed to say this earlier, if you are, you'll be in a managed care organization in all likelihood, nearly everyone is. The MCO, or managed care organization, will do the clinical eligibility screen and then send it to the state office for nurses, the OCO office. Okay, I'm going to touch on 3 more Medicaid programs that involve full scope Medicaid. And these are particular, well, I guess the first one isn't for, is for all disabilities, but the other 2 are specific to clients of DDD, the Division of Developmental Disability. And as many of you know, Medicaid is required in order to get services through DDD. So for some individuals, one of these 3 is the pathway into the Medicaid. They will not have qualified for any of the other programs that we've talked about. So the, pardon me, one second. Okay, so Section 1634 is part of the Social Security Act, and it provides certain protections for disabled adult children. That's a terminology used in the Social Security Act. And we refer to these individuals as DACs because this is an area of the law where we can't have too many acronyms. In order to be eligible as a DAC, you have to be at least 18 years old, disabled or blind prior to 22, and you were receiving SSI on the basis of your disability. And then at some point, you no longer receive SSI because you're receiving a derivative benefit on a parent's Social Security record, either because the parent has retired, passed away, become disabled, or perhaps their benefit amount went up, and so that's changed your benefit amount. And now you're receiving an amount through that derivative benefit that is higher than SSI. You still have to have resources below $2,000. But what this provision does, 1634, it ensures that you don't lose your Medicaid because now you're receiving that higher cash assistance based on a parent's record. There is a process for this that is supposed to be seamless. And I like to give a shout out to Bev Roberts from the ARC of New Jersey, because I took this from one of her slides. She knows this so much better than I, but that the state uses a request for information or an RFI you'll receive from DDD. If they think you're in this category of DAC, that you lost your SSI because of a derivative benefit, it's real important to fill that out completely and timely and send that back. But sometimes that doesn't happen, and you find out you've lost your Medicaid because you've lost your SSI. And I would say if you're in that situation, that's the time to call Disability Rights New Jersey. That's one of the areas we have expertise, and we'll work with you to ensure that you remain on Medicaid as a DAC if appropriate, or another program. I'm next going to talk about what's now called the Community Care Program. It used to be called the Community Care Waiver. Some of you may know about that. It's now in our 1115 waiver, and this is the Medicaid waiver program that provides access to, for example, group homes, as well as supportive housing, a supportive apartment, or something like that. And the eligibility criteria are very similar to MLTSS. So it uses that higher income level of $2,382. The resources are $2,000. Theoretically, there's a 5-year look back with no gifting, though I'm not sure that that happens as rigorously as it does at the County Welfare Agency. And then I have QIT, that Qualified Income Trust, and spousal impoverishment protections with a question mark. And I have that with a question mark because it's in the waiver as approved. It looks like people who are in this program or applying for this program should have those protections. However, they don't appear to be operationalized. And I think that's one of the things that the state is looking at in its waiver renewal. In addition, to be eligible for this, you need to be reached on the community care program waiting list, which has methodology for determining who is next on the waiting list. You need to meet the functional criteria for DDD services. And then that last bullet is the one that I really want to highlight for people, because I think that people don't always know that to be on CCP, you actually have to meet the level of care for an intermediate care facility for a person with an intellectual or developmental disability. We call those developmental centers in New Jersey. So I think that there's been some confusion about this. I'm going to talk about the supports program in a second. Many people are on the supports program and they're on the waiting list, and they just assume when their name comes up, they will be eligible, but they do have to go through that level of care determination. And some people do not meet that level because that's really an institutional level of care requirement. Again, for our DDD supports program or supports plus private duty nursing, same thing as the CCP that we just talked about. And again, very similar to MLTSS. I want to emphasize again that the waiver gives authority for individuals to use a qualified income trust and to have the advantages of the spousal impoverishment protections, which means no spousal deeming of income. And it also gives a much more significant resource allowance. However, they have not yet been operationalized. And for this program, you need to meet the functional criteria for having a developmental disability. You don't have to meet that higher standard of needing an institutional level of care that we just talked about for a developmental center. And my last bullet here is just to highlight about private duty nursing. That private duty nursing has to be medically necessary, and it's covered not by the supports budget, but by the Medicaid MCO. And we see issues around private duty nursing, especially with people who have had them long-standing and their hours are cut as no longer medically necessary. And that too is something that, please, if you're ever in that situation or hear somebody is, give us a call. That's an area where we do a lot of work. And this is just a list of a lot of the services that are available for individuals through the DDD supports waiver. In terms of where do you apply, both of these require that you're DDD clients, that you're DDD eligible. And so you need to go through the DDD intake process, including the New Jersey CAT assessment. In order to be on these programs, you don't have to go exclusively through the income criteria test I was just showing you. You can come in through one of the other Medicaid programs. So for example, you can be on SSI and you can still get the array of services through the DDD supports waiver, or you could come in through age blind and disabled or workability. But for higher income individuals, the people who need up to that 2,300 and change, those applications are processed through the Medicaid waiver unit in DDD. Just want to say a couple words about children. This presentation is really mostly focused on adults, but I mentioned before that New Jersey Family Care brand, which includes both Medicaid and the CHIP program. So children are eligible for Medicaid using that modified adjusted gross income methodology, which is tied to income taxes. And it's up to, under the Affordable Care Act, 147% of poverty. And there's an example for this year for a family of 4. The CHIP program, which is also under that New Jersey Family Care umbrella and can be branded that way. The letters may come from New Jersey Family Care. So sometimes people aren't really clear, are my children on Medicaid? Are my children on CHIP? They don't really know that. That can go up to 355% of poverty. There are also some special waiver programs for children. I mentioned already MLTSS with private duty nursing for children. That is an available avenue. However, the level of care is higher than it is for adults. It's really more of a skilled nursing need. For example, I think the example that I had given earlier was on us having a seizure disorder. There are these other two programs, a children's support services program with children for serious emotional disturbances and children with IDD that are in the waiver. They're administered by the Children's System of Care. They involve the delivery of services through Perform Care. These are not fully operationalized, and they are both seeking to operationalize them and to get whatever additional authority that they need from CMS so that they can disregard parental income for these two programs as part of the waiver or renewal. And again, Michael's going to touch on that at the end. And I would just encourage you to take a look at that and submit, either participate in the public meeting that's coming up on September 27th or submit comments to the Medicaid agency so that those programs can be fully operationalized and the children who need these services and supports, even those who are in higher income families, if you take into consideration their parents' income, can really get the Medicaid benefits that they just so desperately need. So I'm now going to wrap up in the next minute or two. So I'm going to kind of just say real quickly about these slides, but move on. There's also something called Medicare savings programs, which are Medicaid benefits. And they essentially, for people who are dual eligibles, people who have Medicare and Medicaid, they cover some of the costs of Medicare. And these income levels are much higher as well. That goes up to all the way to $14.49 and resources up to $79.70. But all that gets done is your Part B premium. So I don't want to overstate this. You don't get Plan A. You just get your Part B premium paid. But that's still helpful. And here's how you can apply for that. I want to end because I want to give Michael some time too, to just touch on what happens if my Medicaid is terminated. You're required, you have constitutionally protected rights with respect to Medicaid. It's considered a property interest under the 14th Amendment. So you have to get timely and adequate written notice. And that written notice has to include your right to have a fair hearing in the Office of Administrative Law and a right to continuation of services pending the outcome of that hearing. And we are going to be doing a webinar this fall, more in depth on this. But if you receive a written notice terminating, reducing, or suspending your benefits, please reach out to us, or a denial. You don't have a right to continuation of services and a denial because you never had the service. The important thing I want to highlight, though, on getting continuation of services is you have a very short time frame, 10 days, to request continuation of services. And my last point is the one that I want to just shout from the mountain, which is that the state Medicaid agency, the county welfare agencies, New Jersey Family Care, none of them can terminate your Medicaid without first screening you for every Medicaid program the state of New Jersey has. And I just did some of them. I did the big ones, but there are, a dozen more. They have to look at everything before they can terminate you. And I put the law in that tells that for those of us, anybody, in case I have any advocates on this call, but they have to ensure that if you're eligible in another program, that that's seamless and that there's no gap in coverage. The state of New Jersey wasn't really doing this 5 years ago. And I'd say in the last 5 years, they're trying to change their systems so that they do it more consistently and they do it more effectively. And we've really been advocating for that for a while. But if you ever have that situation where you were, for example, on SSI and you get a letter saying your Medicaid has been terminated, again, that is a time to call Disability Rights New Jersey because they cannot do that without screening you for other Medicaid eligibility. And with that, Michael, I'm turning it over to you.
Thanks, Gwen. And I apologize to everyone. I had the world's slowest computer crash where one thing at a time fell away from my control. So I'm back. Thanks for carrying it through, Gwen, technology-wise. So I want to pick up where Gwen left off with terminations. And up on the screen, I put a picture of a do not cross, the hand stopping you from crossing at a pedestrian crosswalk. Because during the COVID-19 pandemic, one of the very first things that Congress did in the very first coronavirus relief bill, the Families First Coronavirus Relief Act, is offer states a little bit of carrot and a lot of stick. They said to the states, we're going to give you a little bit more money in Medicaid, about 5.5% more thereabouts. And in exchange for that money, you're not going to terminate anybody from their Medicaid enrollment or whoever was enrolled as of March the 18th, 2020. So anyone who's enrolled on March 18th, 2020, or became enrolled thereafter is going to keep their Medicaid coverage until at least the end of the public health emergency. So that means that state Medicaid agencies in all 50 states took the carrot and the stick. State Medicaid agencies will not be terminating anybody from Medicaid coverage in that time frame. The public health emergency at the federal level continues as of today. And as far as anybody can tell, it will continue at least through the end of 2021. I don't think there's anybody with a crystal ball who knows exactly when the pandemic will come to a place that the federal government can end the public health emergency. But in the meantime, there's a little bit of breathing room for folks on Medicaid. The only reason that you could be disenrolled from Medicaid in this time frame is if you voluntarily disenroll yourself, or if you leave the state where you have Medicaid coverage. So that's a very, very strong protection for Medicaid enrollees. And it makes some sense. In the middle of a public health emergency, you don't want to start stripping away people's access to health care or services and supports that they need. There were some folks, especially near the beginning of the pandemic, who lost their SSI eligibility for a multitude of reasons and got some very misleading letters that may have said, you'll lose your Medicaid coverage too. As far as we know, everybody that we talked to who got one of those letters, we interfaced with the state, did not actually lose their Medicaid coverage. If, again, like Gwen mentioned, if that happens to you, if you get a message during the pendency of this public health emergency, it says you're going to lose your Medicaid coverage, forget even about the normal rules. During the pandemic, that should be going on. And we don't think New Jersey's doing that, but if it happens to you, please pick up the phone and give us a call. Next slide, please.
Uh-oh, Michael.
Same thing, huh?
Oh my gosh. Oh, there we go.
Oh, great, okay. So on this next slide, we have a picture of the Hoover Dam in Nevada. And, you know, I put this picture on the slide to kind of put into perspective that because this protection is in place and because now we are, you know, cruising well into year number 2 of a pandemic and the public health emergency, that's creating a pretty big backlog of some people who maybe truly lost all of their eligibility. Maybe they received SSI, and if you were to take a square look at all the other Medicaid doors that Gwen just talked about, there's no other doors they could possibly be eligible for Medicaid for, and they would have, except for the public health emergency, lost their Medicaid coverage by now. So there's this big old backlog, and we don't know when the public health emergency will end. It really seems like it changes day to day. We do know that anyone who is eligible since March 2020 is still in this reservoir of people receiving Medicaid. And there's going to be a lot of backlog, a lot of work for the states to do if there are folks who lost their door they came in through. So for example, if they lost their SSI benefit, they may be eligible through another door. That's a lot of screening for the state to do. So the Federal Center for Medicare and Medicaid Services, you might hear it referred to as CMS, has issued a few different guidance letters to the state Medicaid agencies over the country. And the most recent one came out in August of 2021, so it's pretty recent. But this guidance gives states 12 months from the end of the public health emergency, whenever that may be, to complete full evaluation for all of the Medicaid beneficiaries who may have lost their eligibility during the public health emergency. If for some reason the state was kind of trying to stay ahead of the game, and we know at least New Jersey was doing some of this, you know, staying ahead of the game and analyzing to see, okay, maybe you lost your SSI, but you're a DDD beneficiary and your income meets all those limits. We'll just, you know, we can take care of this now. We can do this seamlessly. We can keep you Medicaid eligible. There's really no termination that needs to go out. But if the state did that kind of analysis and found that you didn't meet any of the other doors during the public health and emergency, CMS has told the states you can't use that to terminate someone's Medicaid eligibility. You have to check again just in case something has changed about that situation where somebody maybe now fits under another door, or maybe now they're eligible again for SSI, or who knows, somehow can maintain their eligibility for Medicaid coverage. CMS has been very specific that the state Medicaid agencies have to check again after the public health emergency ends. This guidance could change again because we don't know how long this might go on for. If it changes again, we'll try to make sure that we keep everyone apprised through our website and social media presences.
So Michael, can I just dovetail on something you just said? Because it's something we saw here at Disability Rights New Jersey, and I think it fits in as a great example to what you were just pointing out. So we found that we got calls from people who were improperly terminated from Medicaid because they were on the workability program, and because of COVID, they were no longer working, right? So this was especially true right in the early days, like last March through last June. And if a county welfare agency did a redetermination during COVID and made the proper determination that the person was no longer eligible for workability, but did not terminate them because of the public health emergency, that won't be dispositive come the end of the public health emergency. And so, I'm not going to be surprised to find that many of those people, or at least some subset of those people, may have either returned to the job that they were laid off of because of COVID, or perhaps have a new job, and so are once again eligible for workability. So I don't believe that there's going to be any in that kind of situation. It should remain seamless that the person was on Medicaid throughout the public health emergency and they'll be back on it on the other side. One thing I've just seen my first case on yesterday that makes me think maybe something's buzzing out there. And I think this goes to a question that was in the chat box. I can't see the chat box, but I saw this one question flash up quickly, which is, how do I know which of these doors I'm under and if it changes? I saw somebody who was on workability who looks like now they're on Medicaid only. And I do wonder if the county welfare agency changed the coding in their system, because they're not really eligible for Medicaid only either, but they just have to have a placeholder. So there could be some confusion like that, right? That goes on in the system where they code what program people are on. And so it's probably not a bad idea to reach out and find out what program you're on. And you can do that through the medical assistance customer centers. And now those people are going to hate me when everybody tomorrow starts calling them en masse. So I don't have that number prepared right now, but perhaps, Michael, we could figure out a way to send that when we send everything else to people. You can
I'm going to put a link in the chat.
Great. So it's on the Medicaid agency's website, and they call themselves MACs, which is confusing for those of us who go to MAC meetings, because it's MACC, Medical Assistance Customer Centers, what I believe it stands for. And they're regional offices, so there are several counties in each office. My experience with the ones that I've worked with over the years have been excellent. But you call and you give them the information, and they're able to look, and they're able to say, from this period to this period, you were on workability. From this period to this period, you were on Medicaid only. They can also tell you which MCO you were on during different periods. They can say you were on SSI, so they can give that information. It's information they have and that they can give to you. But let's not all call tomorrow, right? Let's try and space it out over the next week so that they don't say that Disability Rights New Jersey gave out our phone numbers. Were you able to put that in the chat?
Yeah, I put in the chat a link. If you follow that link, there's a guide to, depending which county you live in, which customer service center you should be calling that covers your region. It's very easy to read, very easy to navigate. The phone numbers are right up there. So,
because I'll tell you one other quick example, and then Michael, maybe you can help with questions. I know we're coming up on the end of the hour. I have also seen somebody who was terminated from SSI who should not have been, right? So they're still working with the Social Security Administration to straighten that out. But the state did move that person to Medicaid only rather than the previous category. So there could be clinky kind of mistakes in the system. This is new for everybody. There's been a lot of confusion. So it may be worthwhile at some point to just check out where you are and that it aligns with what you think it should be. So.
All right, yeah, let's take a look. Yeah, 4 minutes left in the hour. I can stretch a little bit over if we need to, but we have a few questions in the chat. And I apologize, I lost a lot of the ones early from the chat when my computer flopped. So I don't know. I saw one question very early on that was talking about ABLE accounts and how money in an ABLE account affects Medicaid eligibility, and whether there's a top dollar cash limit on money inside an ABLE account. I don't know, Gwen, if you have that information at your fingertips, if you want me to take it.
Yeah, so, and by the way, just so everybody knows, I opened up the questions really big to see if I could help with that, Michael, but now I can't see all your lovely faces anymore. So I don't have that information memorized, though if you go to New Jersey's ABLE account page, I'm sure it gives those limits. You can put a certain amount in every year, and probably somebody on the chat knows better than me. I believe it started as 14,000 and is now higher. And there is an overall limit on the amount of money that can be in the ABLE account. But keep in mind that the ABLE account can be used also. So it may be that money goes in, but then money is appropriately used. And so more money can be put in over time.
Thank you. I think you addressed, Mercedes from the council had asked, how does somebody know which Medicaid door they've gone through? I think you answered that question with the customer service, the medical assistance customer service center.
Yes, it's one way of doing it, but not all at once. Go ahead, Michael.
Okay. I'm putting the ABLE information in the chat too, if anyone wants to follow the link. I see one person messaged me directly with a very, very case specific set of facts. And Jennifer, I'm going to ask if you want to consult with us, reach out to our intake. I put our website in the chat right away at the very top of the hour. It's disabilityrightsnj.org. You can complete an intake and we'd be happy to talk to you about your specific situation. I don't think that I want to talk about specifics in a public forum. I don't want to expose anything confidential for you.
Michael, I see a question here which you might have lost, which has to do with whether or not a person who turns 18 can apply for Medicaid and SSI. And the answer to that is yes. And just remember that the SSI application is with the Social Security Administration, the federal government, and that counts as the Medicaid application. You do not have to do a separate Medicaid application through the state of New Jersey.
Let's see. Liz had asked whether her 25-year-old son needs to be enrolled with DDD before he can apply for Medicaid. I think that's a pretty easy answer, Liz. The answer is no, they don't have to be enrolled with DDD first. You can start that process with Medicaid. But I can tell you that right now to receive DDD services at all, one must be Medicaid eligible. So one of the first things that they'll tell you to do is start the Medicaid application process if you haven't already.
And I also just want to add that that's another thing that we talked about 21 for the DDD services. And when I talked about some of the Medicaid programs, it was 21 or people 20 and under, and that's because there's a special benefit through Medicaid for people who are under 21. But some of that may be changing also with this renewal waiver, bringing at least accessibility to DDD services to some 18-year-olds. So you got to really just pay attention. We'll do more webinars on that on the future next summer, but really, you know, paying attention because the rules do change. Any other questions, Michael?
I'm looking at the chat to see if there's anything new. Somebody had asked if there's a benefit to picking one door over the other. So for example, applying on njfamilycare.com versus going to the county to be considered for ABD, if there's any advantage.
Well, those are two different programs, and I would encourage, as does the state, that you use the online portals wherever possible. That is, because you have a date stamp time that you get the email back saying that the application has been filed. So I would recommend using online. In terms of the different programs, you know, there are differences between the programs that just give what we used to call community Medicaid versus institutional Medicaid. The community programs don't give you the waiver services. I really shouldn't even use that language anymore. It's so antiquated. But you know, you might want to be in a waiver program because you want to have access to the waiver services. And I think that's true for people who, adults with IDD, right? Because they want to have the budget and access to all those services. But that doesn't mean you can't go in through ABD and be on the supports program.
And I think this is going to be our last question, just because we're already a little over time. And there's one really important thing that I want to make sure we get up on the screen. And this has been a hot topic for us recently. Karen asks in the chat, are there any rules or changes in the rule that a person must be a resident, I'm assuming they mean of the US or New Jersey maybe, before they can be eligible for Medicaid? So I guess the citizenship or residency requirements, Gwen.
So in terms of residency for New Jersey, the regulations, it's your desire to remain in the state. There's no durational limit. You do not have to be here 30 days, for example. I know we're up on time. That gets more complicated when you're somebody from another state coming into a nursing home in New Jersey. So for example, New York places a lot of minor children in a pediatric nursing home in North Jersey. New Jersey is going to take the stand that those children remain residents of New York, right? They don't want New York to do that and then have them be on New Jersey's Medicaid dime. So it is a little bit more complicated in some situations.
And I think the second part of that question is for people who come from abroad who potentially are immigrating to the United States. As far as receiving Medicaid as a recent arrival to the United States, I believe there are some time limits, right?
There are some limited exceptions, but generally there's a 5-year bar. And outside my area of expertise on the immigration, but that gives me an idea that maybe we can partner with legal services or somebody else who really is the immigration expert and do a presentation on that in the future. Okay. Great question.
Yeah, it was a really excellent question. I think that's going to be our last one. Again, if anyone has any case specific stuff that they want to ask about, I saw Susan had another case specific, reach out through our intake line on our website or on the phone. We can talk to you about specific cases. Don't want to do that in a public forum. Gwen, could you go 2 slides forward? They'll go past the question slide and then the last one with the 1115 renewal. Perfect. This is it. So this is related. If you're in this webinar, you're at least mildly interested in Medicaid. If you sat through till the end, you're definitely interested in Medicaid. Gwen mentioned this near the top of the hour. It's hugely important. New Jersey is renewing its comprehensive Medicaid waiver. This waiver covers services for managed long-term services and support, the Division of Developmental Disabilities. Both waiver programs are part of the comprehensive waiver. Children's system of care, perform care services, traumatic brain injury services. This is an extremely broad, it's comprehensive, and they mean it. It covers a lot of home and community-based services for people with disabilities. The waiver comment period is only 30 days for this renewal. So to have a chance to look at the whole waiver, to read through what the state is proposing, and to submit a comment, you've got to get it all done by the end of the business day on October 11th, 2021. That's not very far away. I put up on the slide here the link to the Medicaid website where you can read the proposed waiver language. And it also comes with all the instructions in the forms if you would like to submit your own comments. Disability Rights New Jersey is, of course, reviewing this waiver and will undoubtedly be submitting comments as we find things that we like or things that we think could be improved. But you, as the interested public, should also be doing that, because the more sources and the more voices that speak up about the services in this waiver, the more powerful and the more effective it will be for people with disabilities. So if you have personal experience or family experience, or you otherwise have something to say about the way waiver services are delivered, this is your chance to shape the way this is going to work for years to come. So I really, really, really encourage you, if you have a minute, go to the website, review the waiver language, and make a comment if you have something to say.
So thank you for that, Michael. I have one other thing. We didn't engage in self-promotion here, so I have to just add it. We forgot a slide. So again, huge thanks to the New Jersey Council on this partnership around creating what we hope have been a series of very accessible and useful webinars and self-advocacy materials. And this is part of that series. And we are having a conference, Assistive Technology and Community Inclusion, next week, Thursday and Friday. I think that's the 23rd and 24th. It's virtual. You can go to our website or our social media to sign up. It is free of charge. And we have amazing sessions and keynote speakers. And in fact, Our Medicaid director is our keynote speaker on Friday, and she's going to be discussing a lot of these things as well as the waiver renewal. So I would encourage people to take a look there as well if you're interested in hearing more.
All right, I think that takes us, we're 6 minutes over the hour, so we appreciate all your patience as we crammed in a little bit of extra information there for you. Thank you so much for taking time. I know everybody has absolutely packed schedules these days, so for spending some time with us, learning about Medicaid. The slides and the recording will go up on our website at disabilityrightsnj.org. Again, special thanks to the New Jersey Council on Developmental Disabilities. Without their support, we would not be able to put on presentations like this, so thank you to NJCDD. All right, everyone, have a great afternoon. Stay safe and
Great.
healthy.
Thanks, everyone. Bye-bye.